Okay, good evening, everybody. Good morning, good afternoon, depending on where you're zooming in. Welcome to today's health seminar. Being a Sunday, we meet and we talk about matters health, how you can live a longer, healthier life. And today we are especially privileged to have a fantastic guest speaker. He's a medic, and he's somebody who has a vast of experience with these products. And he actually has used the products. He has an experience with Neon Life. He's going to tell you his story. And without further ado, I'm going to welcome Kevin Rubia, Daktari, to come and give us his session. Karibu, Daktari.
Thank you so much, Fred, and everyone who's joined this health talk. We are around 127 participants in the room, and I'm happy that you've all made it on a Sunday afternoon or evening. As Fred had alluded to earlier, this topic today, bone and joint health, has a personal significance in my own life. When I was a teenager, I had multiple swellings and joints, from my elbows to my knees to my ankles, and I was suspected to have rheumatoid arthritis and received a series of injections. When I got to my 20s, that was when the diagnosis of this long condition, which I don't want you to focus on, just know it's a condition that usually causes the joints to swell without a very known cause. It's called pigmented villonodular synovitis, PVNS. I was diagnosed with that in my 20s, and after a series of surgeries in my knees, both right and left, it finally got resolved by 2020. However, last year, in June 2023, I was diagnosed with yet another condition that affected my joints. My body one day could not wake up. I couldn't move my limbs. My joints had failed. My muscles had failed. And on going to the hospital, after a series of tests, I was discovered to have undifferentiated connective tissue disease. Connective tissue is what supports our joints. And currently, I'm on medication. You'll get to know more of my journey as we continue. Maybe some of you have had a similar experience with whatever condition, especially to do with bones and joints in this case. Or you may know someone in your family or your group of friends who may have had a similar journey. Today, we'll talk about joints and bones, and I'm going to use this outline. We'll talk about bones and joints with a basis, with a foundation, so that we're all on the same level as we continue on this journey. Then we'll identify some common diseases that you may have come across in relation to bones and joints. And finally, disease prevention, what we can do, including supplementation, which has helped me in my recovery journey. Let's begin with some background information on bones and joints. The function of bones, as you may know, are to provide mobility for you to move from one place to another, or you to get one thing to another place, like this bottle of water to my mouth. Support your body, because without that bone structure, your muscles and other organs would not have a structure. And protection for the body. For example, we have a rib cage on our chests that protects vital organs like our lungs, our liver, and our heart. The reservoir function is the storehouse for calcium and phosphorus. Our bones are also storage organs for these important minerals. A joint is referred to as a place where two or more bones connect. Then throughout life, bone undergoes changes. However, when we reach our early 20s or late teens, our bones tend to reach full maturity. The stronger the bones you have at that particular time, the better your body is able to deal with any withdrawals of calcium and phosphorus that are needed, and with any other changes to bone that occur due to aging. Naturally, our bones degenerate due to aging, and the calcium and phosphorus stores that we have tend to decrease. So it's important to understand that relationship between bone and minerals like calcium. There are many factors that determine bone health. I'll talk about the three main factors, and they are as follows. Genes. Some of us may be genetically predisposed to have bone conditions. Others, at the end of the day, may get these conditions because of the predisposition in the family. Secondly is hormonal, and this is a very common factor. One example of hormones that control the regulation of calcium, which is indeed important for strong bones, is calcitriol. Calcitriol is derived from vitamin D. Sex hormones like testosterone in men and estrogen in women are also important. You'll note that there is a growth spurt in teenagers due to these hormones. And for ladies who are menopausal or postmenopausal, since estrogen decreases, their bone density or the strength of the bone reduces due to that decrease in estrogen. Lastly is lifestyle, and many things come to play when we think of lifestyle. First is nutrition. For example, a deficiency of vitamin D in children will result in rickets. And therefore, it's important to eat foods rich in vitamin D. Exercise helps to promote good health, not just for your organs, but specifically for your bones. They increase in strength and resilience. Conversely, someone who does not exercise may therefore have weaker bones and joints. Some of us, as like me, for example, I play rugby. For anyone who does activities due to their occupation or their recreation that tend to harm their bodies by physical force, like trauma, that would predispose them to bone conditions like fractures. So it's important to realize, even in your day-to-day work or sports, that you may risk injury if you're not careful or if your bones are not strong enough. Substance use and abuse is another factor, and things like alcohol and smoking have shown to affect the strength of the bone and the density of the bone. Thus, that in a nutshell are things that determine the bone health. Let's now proceed to the next thing. We've started with basic foundations to help us understand more about bones and joints. Now, what about the diseases that we have known or come to know, and how they are treated, prevented, and diagnosed? We'll only focus on three for purposes of this presentation. We'll only do osteoporosis, osteoarthritis, which is commonly called arthritis, and autoimmune diseases like rheumatoid arthritis. Autoimmune diseases are those that come without a necessary cause. Let's begin with osteoporosis, which is the most common bone disease. Osteoporosis is usually referred to as a loss of bone density, and it has many causes. You'll see in this diagram a picture comparing a healthy bone and an osteoporotic bone. When we talk about bone density, we're talking about the firmness of the structure of the bone. So much so that if the bone to the right is hit by an external force, it will likely fracture or break. The diagram to the right helps summarize osteoporosis for all of us, where we said it occurs when bone density decreases and the body stops producing as much bone as it did before. The symptoms of osteoporosis include back pain, loss of height over time, and a stooped posture. There are many risk factors of osteoporosis. One of them are women who are postmenopausal. Men with significant smoking history tend to risk or increase their risk of getting osteoporosis. Alcohol has been shown to reduce bone density. We also have a family history. As we said, some of these conditions are genetic. If you have an inactive lifestyle, meaning you're not exercising your muscles and joints as often as you should, you could increase your risk of osteoporosis. Thin and small frames people, because of that nature of their bone, may tend to have osteoporosis. If you have low calcium and vitamin D in your body, you likely risk getting osteoporosis. Normally, as we said, age makes our bones a bit weaker as we continue in this thing called life. So getting older increases your risk. Low testosterone levels, corticosteroids, which are medicines that are usually prescribed, and medical conditions that weaken calcium absorption. Now, there is a way to diagnose osteoporosis, usually through the DEXA scan. Ultrasound and blood or urine samples may also be useful. There is treatment, however, for osteoporosis, and nutrition and exercise have a role to play. It therefore goes that if you limit your alcohol and usage of cigarettes, take supplements or foods rich in vitamin D, and exercise regularly, you may prevent osteoporosis, especially if you have a high risk in your family. That was osteoporosis. We'll go to the next one, which is rheumatoid arthritis. And I decided to combine it with osteoarthritis so that we learn about them both together and avoid any confusion. Osteoarthritis is usually asymmetrical, while rheumatoid arthritis is symmetrical. What does that mean? If I have osteoarthritis in my left wrist, it will most likely only be in my left wrist. But if I have rheumatoid arthritis affecting my left thumb, it may mean that I may also have rheumatoid arthritis affecting my right arm. That's the difference between asymmetrical, which means one-sided, versus symmetrical, which means both sides. By definition, osteoarthritis involves deterioration of the articular cartilage. Articular cartilage is what is the cartilage separating two bones, and articulation is where they meet. So the cartilage is important for protecting the joint, It also has a membrane that provides fluid that allows movement in the joint. So when that cartilage deteriorates, osteoarthritis, loosely called arthritis, comes about. When we talk about rheumatoid arthritis, however, we are talking about the joint as a whole. It attacks the synovium, the whole connective tissue within the joint, and mostly affects the wrists, fingers, and elbows. It can also be systemic with fever and anemia. Fever meaning high body temperature, and anemia, low hemoglobin, or the red coloring pigment in the body, in your blood. There are various risk factors, symptoms, and ways you can test for both osteoarthritis and rheumatoid arthritis. For osteoarthritis, the older you are, the likelihood you risk of it due to the wear and tear. However, as we had said, rheumatoid arthritis is an autoimmune disease, meaning the cause is usually not known. In terms of age, rheumatoid arthritis can affect any age, usually between 20 and 60. For osteoarthritis, the other risk factors include being overweight, repeated injuries, and a lot of manual labor. Let's talk about the symptoms. For osteoarthritis, there's usually joint pain that is hard and body in nature. When we talk about rheumatoid arthritis, however, the joints tend to be soft and warm due to inflammation that happens and causes redness. The joint is stiff in osteoarthritis, but not as stiff in rheumatoid arthritis. Testing, I won't go into details for that, but rheumatoid factor is positive in rheumatoid arthritis, while a simple X-ray could help diagnose osteoarthritis. Of importance, we said there is inflammation or swelling, redness, and warmth that happens in rheumatoid arthritis that does not happen in osteoarthritis. In terms of treatment, we can treat with exercise, things that we can do, some non-steroidal anti-inflammatory drugs, something like diclofenac, and resting the joints. Sometimes other things can be done, for example, realignment in osteoarthritis, while steroids are useful in the treatment of rheumatoid arthritis. That, in a nutshell, summarizes osteoarthritis versus rheumatoid arthritis, which are very common conditions in our setting. Now, we'll proceed to the third thing, the third and final thing, which is disease prevention. And some of you may already know how to prevent this. We've also discussed it, but this slide will summarize all that. The first thing is exercise. And exercise, we have said, strengthens the bones and the joints. A sedentary lifestyle makes you weaker naturally. So whenever you have stress, by stress, I mean, let's say something hits you, that physical stress or trauma, if you have a weak bone, may tend to get fractured. But if you have been exercising, taking care of your weight, you have increased that. Also, exercise tends to increase the blood flow in the body. That is important in supplying not only the body, other body organs, but also the joints. Smoking. Smoking is a risk factor for very many diseases, not just those affecting the bones and the joints. It's important to try to avoid smoking because of reducing your bone density as a result. As we've said, smoking affects many systems. So your respiratory system, your cardiac system, which is the heart, respiratory to do with their lungs, is affected. It's also very addictive and hard to stop. So the earlier you stop or avoid it, the better. Drinking also affects bone density, as research has shown. But also, you may think of someone who's drunk, they may not be able to walk properly or think properly, increasing their risk of falls and fractures as a result. It therefore goes without saying that if you reduce your drinking, you probably will eat better, a better diet that is rich in vitamin D and calcium, for example, and live healthier. The heavier you are, the more you exert pressure on your joints. When we work on losing weight, our bones and joints have less stress on them. Remember, our bones are not just there to support us, but they're also there to store vitamin D and other minerals. It's therefore important to reduce this weight on them, as bones have a lot of function. You can imagine trying to balance your weight and also make sure that your minerals like phosphorus and calcium are maintained in the body. Weight loss has shown to reduce the risk of osteoporosis and osteoarthritis. Using medications cautiously is important. Some medications, like steroids, could lead to osteoporosis or reduce the bone density in our body. They increase the risk of things like osteoarthritis. Please try to only use prescribed medicine, as your doctor will be able to know your history. They'll be able to understand if you, for example, have a high risk of osteoarthritis in your family, and therefore prescribe accordingly, even if you do not necessarily have a joint issue. So it's important to make sure that when you go to a hospital, talk about some of these things, like the risk of arthritis in your family, because it will help the doctor prescribe the right medications for you and avoid things like steroids. Injury, if you can, please avoid it. This is particularly important for those who play sports or those people who have, let's say, to load vehicles with heavy objects. It's important to exercise regularly so that your bones are strong, same to your muscles, and wear protective clothing where possible, such as gloves or knee pads, to avoid injury, because we want to protect our bone at the end of the day and prevent illness. Routine screening is important, especially ladies who are approaching their 50s. As we said, estrogen reduces in menopause. Therefore, it weakens the bones. Estrogen is important in maintaining the bone structure. If you're able to screen routinely, know your calcium levels, your bone density levels in advance, or even start calcium supplementation as early as possible if it's not in the right amount in your diet, then you can easily prevent disease. There's foods that are rich in vitamin D and calcium, as you can see to the right, and that's important when it comes to nutrition and healthy diet. Things like dairy products, soy, bread, which is whole meal, and vegetables like broccoli, kales, have high calcium. And therefore, it's important to, from an early age, take foods rich in calcium. That said, calcium supplementation may be important, or vitamin D supplementation may be important when it comes to those of us who already have disease, or those of us who have high risk of these diseases in our family. Even if you do not have high risk, it's important to have regular checkups to see how your calcium levels and other levels of minerals in your body are, so that you prevent disease. One way that has helped me become better is supplementation, and that's what I'm going to discuss next. There are various products that New Life has recommended to help you strengthen your bones and joints, and I'm going to talk about 3 of them. One is chelated CalMag. We'll talk about chelation later. Calcium is calcium, mag is magnesium. Now, while calcium is critical for the development and maintenance of strong bones and teeth, emerging science shows that we need more than just calcium to optimize bone health. There are benefits to a combination of calcium, magnesium, and vitamin D, which in fact go beyond just bone health. Why is it important for the 3 of them to be combined in a supplement? And how does this benefit you as they take out these supplements once you get your chelated CalMag? Research shows that calcium intake, when combined with sufficient vitamin D, a healthy diet, and regular exercise, may reduce the risk of developing osteoporosis. Magnesium contributes to the development and maintenance of bones and teeth. Calcium and magnesium, while contributing to the development of maintenance of bones and teeth, also play a role in maintenance of normal muscle function, and they're important in maintaining good health. Vitamin D assists in the absorption and use of calcium and phosphorus. Why Neolife? As there are many calcium or calcium magnesium products in the market. The first reason is that it supports stronger bones and more. The perfect blend of chelated calcium and magnesium with high potency of vitamin D3 to support a broad range of health benefits, including cardiac or heart health. Secondly is the chelation that you are talked about. Chelation is just a combination for fast absorption. As you can see in the diagram below, the mineral, which is calcium and magnesium, has been joined to amino acids that increase the absorption of these minerals, calcium and magnesium. It also prevents irritation to the stomach and intestines. There is also a preferred ratio of 2:1, 2 for calcium to 1 magnesium. There's high potency and bioavailability. That means it will act fast and it will be highly available for your body to absorb. It's easy to swallow with Goche tablets, and it's pharmaceutically pure because of the seashell source calcium. There's a lot of research that goes into coming up with products, not just chelated CalMag, that makes sure you get the best and it's all natural. Secondly is a product that I've used a lot. In fact, it finished yesterday, Full Motion. I need to get my next batch. This was important for me when I was diagnosed with undifferentiated connective tissue disease last year in around June. And I had a lot of pain that was not resolving with painkillers. When I started taking Full Motion, it reduced the pain. Let's talk about Full Motion. We had talked about cartilage earlier, being the surrounding of bones at the point at which they meet another bone, that is in the joint. And healthy cartilage allows the bones to smoothly glide over one another without joint pain and without discomfort. Glucosamine, which is a very important product, building block, is the primary building block of joint cartilage. It's naturally produced in the body from glucose and glutamine. Scientists believe that as the body ages, its capacity for producing glucosamine and ultimately cartilage declines. This loss of glucosamine production, combined with an increased demand due to physical activity and age, can result in pain, stiffness, and loss of mobility. Neolife's Full Motion provides 1,500 milligrams of glucosamine, the dose used in studies and shown to reduce pain and stiffness. Why is it important to supplement glucosamine? There are 5 main reasons, one of them being preventing the cartilage damage. As we had said, glucosamine is important in cartilage formation, and as it reduces with age, we therefore reduce our cartilage production and increase the damage. To slow down the breakdown of cartilage is the second reason as to why glucosamine should be supplemented. Because as you have seen, as we come to see actually, that glucosamine has high anti-inflammatory action. Inflammation increases the breakdown of cartilage. Whenever a joint is inflamed due to infection or the diseases that we've talked about, cartilage breaks down as a result, as we saw in osteoarthritis. Third is that it helps build, repair, and regenerate cartilage. Fourth, it reduces pain and immobility once you supplement glucosamine, and it's quickly and efficiently absorbed from the intestinal tract, from the intestines, and rapidly incorporated into joint cartilage. Apart from Neolife being a rich source of glucosamine, there is another important component of glucosamine, or rather Full Motion, and this is the Herbal Comfort Complex. It has 3 main ingredients that are strongly associated with the body's natural mechanisms for minimizing joint pain, and inflammation. That, I think, is why I got better after taking these tablets. Last and not least is omega-3 salmon oil plus. For this one, I wanted us to go specifically to a study that has been shown to benefit people who have taken both omega-3 and Full Motion, which has glucosamine, in the reduction of their symptoms. Salmon oil has been shown to reduce inflammation, and that's why it's important when it comes to joint health. And a study was done rather, and this is a peer-reviewed study, meaning it was done by a body that is not associated with Neolife. There are many studies that can be done. Just to give you an overview, is that there are Neolife studies that are done specifically by the company. However, there are other peer-reviewed studies. These are independent studies that still show the benefit of our products, and in this case, salmon oil. To go to that study, it was a study that was to show the effect of glucosamine sulfate, which is present in full motion, with or without omega-3 fatty acids in patients with osteoarthritis. A study was done where two groups, people who are only put on glucosamine sulfate and others who had both of them, the full motion and omega-3. These were the results, that there was therapeutic and statistical superiority for the combination product of glucosamine sulfate and omega-3, reducing symptoms such as morning stiffness, pain in the hips and in the knees. For the group that did not have it, there was less success than the group that had both supplements. It therefore goes to say that it's important not just to take these supplements separately or independently, but actually combine them, because there is increased benefit. I now would like to hand this session back to Fred, unless there are any questions or comments.
Thank you so much, Daktari. Yes, there are a couple of questions, but that was a fantastic session, quite informative. I like your presentation, very, very nice, very simple, very nice. The first question is dental challenges. Is there a relationship between dental challenges and bone health? And the other one was sciatica nerve. Is there a relationship between sciatica and bone challenges? I think those are, you can take those, then I can look at others.
Fantastic. Yes. Calcium is important not only for the bones, but also for the teeth. And that's why even in my presentation, I had mentioned teeth at some point. When you have low calcium, your bones are not as strong, same to your teeth. So there is a high relationship between calcium relationship between bones and teeth. The relationship is now the minerals that strengthen both of them, which is calcium. The second question was to do with
Sciatica.
Sciatica. Sciatica is a pain due to a nerve called the sciatic nerve that usually crosses the hip. Joints are, it's a mechanism. We cannot talk of a joint without talking about the nerves that are around it, without talking about the muscles and things like the bones themselves. So whenever a nerve, in this case, the sciatic nerve, is affected through impingement, which is, it is pressed against, let's say, a bone or a muscle due to trauma or injury, or is affected due to disease, the joint around it will therefore ache, either through referred pain or direct pain. It's important, ladies and gentlemen, to increase our nerve function, and that's how a product or foods like salmon oil or salmons rather, or omega-3 promote nerve function. So whenever our nerves which cross joints or even help in the movement of joints, whenever they are affected, either due to disease or due to, let's say, injury, they therefore will affect the joint automatically. And it's important, therefore, to either increase our supplementation of foods that will help provide good nutrition, not only for our joints, but also for the nerves. And those foods, as we've said, are rich as a fish. Fish that supply omega-3, such as salmon, help give you that full broad-based nutrition. Hope that is well answered.
Yeah, fantastic, fantastic. There's somebody who is asking about the spine. Somebody with a congenital spine defect on the spine. Can they be assisted? And I see another question here. How about a bulging spine that has pressed some nerves that's causing leg pains? How do you go about it? I think those two are actually very closely related. And then lower back pain, I think that is also closely related to that. And then somebody is asking, are these supplements from natural feeds? Are they natural? Are they organic? Maybe you can tackle those ones.
Thank you. And also Dr. Harriet for assisting me with the answers in the chat. First of all, I'd like to say that there are doctors specifically who specialize in treatment of bone. They are called orthopedics. Orthopedic surgeons specifically deal with this. So it's best to seek advice of a doctor and be referred for your specific condition. As I've seen, some of you have issues that have had even MRIs, scans done with not solving anything. So it's important to get an orthopedic surgeon to review you, and that can be done through the doctor that sees you. I may not provide full solutions, as for you to, some of these conditions need a history. For example, to know your family history, to know your risk in the family, to know whether you take alcohol or not, smoke or not, because this will help come with a specific diagnosis. Now, to answer the questions that have been asked, the congenital defect, congenital means something that someone is born with. I have not seen, or rather I've not come across studies that have shown that this particular product will help the baby or the person born with a congenital defect. So I think the best person to answer that question would be a neurologist, or again, an orthopedic surgeon who may be more versed with what specifically could be best to treat these conditions. As a side note, by the way, these products are not, they are not intentionally made to treat diseases. As I mentioned on my first slide, I'm still under medication. These supplements have just shown to improve results and to help me not use others like painkillers. So these are not in any way to get rid of any medication that you may be having. Secondly, was the one to do with bulging spine disc. Again, that's important that you have a physical examination by a doctor to see your range of motion and to see what exactly needs to be done. Sometimes rest alone or stabilization of a joint may be enough to help relieve pain, and maybe topical application, that is application of a painkiller on the joint. That could be enough. Sometimes you may need surgery. So it really depends on what the severity is and what the cause is, which is best done through a physical examination with history taking and some examinations like an X-ray and MRI. Then we have...
Yes, there is a question here, or rather, somebody says he had some trauma back in school when he was in schooling days, but by carrying loads, he got some bit of trauma. So nowadays he gets back pain, but all the tests show that there is nothing wrong with him. So as you answer that one, there is somebody was asking, should I buy the 3 supplements, that is calcium, full motion, and omega-3 together so that I can fix my bone issues better?
Thank you for that. I'll start with the one who had an injury in their youth. Unfortunately, as we grow older, some things that we did in our youth tend to come a bit more clearly, either through pain or mostly pain. So it would be nice to be checked up again. It may not necessarily be that particular injury that is the cause of your pain at the moment, even if your scans are showing nothing. It may be repetitive stress, meaning accumulation of small injuries over time, plus the normal aging process that has made you feel the way that you feel. As scans may have shown nothing in your case, I would advise you to still visit an orthopedic surgeon so that they may prescribe a particular drug, be it a painkiller that you could apply, or if in your case you are taking alcohol, if you're taking, if you're overweight, if you are smoking, those may also help reduce that pain that you're feeling. Some of our products, as I said, like myself, Full Motion has helped me with pain reduction because of reducing inflammation. So some of these supplements may be of benefit to you. Leading me to answer the second question, is there is increased benefit by taking all the 3 products together. It also therefore depends with your budget, because you may have wanted, like for me, I wanted to take all 3 in combination. In fact, there's another one called Trenen that helps with the absorption of any medication that you have together with these supplements that you're taking. It's important to even add that to the mix if you can afford, because as we have seen, studies have shown increased results. Therefore, I would say yes, it's important to take them in combination if you can.
Okay, there is a lady who is concerned about her wardrobe. And she says, heels, the case of heels, do they affect joints if you wear high heels and walk in them?
I do not wear high heels myself. However, I have seen or heard many stories of ladies who have had issues to do with their ankle joints as a result. I would wish the ladies in the room would tell me more. However, our heels are not naturally supposed to be high like that. I even see many ladies who maybe carry high heels to work, but then have their rubber shoes on the side so that they can be able to walk freely later. It's important to balance this for any lady in the room to make sure that you have good support for your heel by having low, comfortable shoes that allow you to move and are still fashionable. High heels have their room in the place in the boardroom, but make sure that, especially on the weekends, if you can, wear comfortable shoes not necessarily flat, because there's many ladies that who also wear flat shoes. So it's important to make sure that because as you see, when you put your heel on the floor, there's a space, that curvature. That's important. A flat shoe makes it just flat, but shoes that have just the normal heel, but still provide that curvature are important.
Okay. Fantastic, fantastic. I think that wraps up the questions that are related to this presentation. I see many people have other questions on various issues, which you may not be able to cover because we'll be here until tomorrow. And if you have a question, please talk to the person who invited you. I see somebody asking about Pro Vitality, another one about TNN. Just ask the person who invited you or sold you the product, or you can call Neolife directly, and you will be assisted with any challenge that you're going through. We are always there. There's a channel of communication. If the person who sold it to you cannot answer it, you'll talk to your sponsor, and the information will then trickle back down to you. So that will be taken care of. But otherwise, Daktari, it was great, great, great. I'm excited. I'm excited. That was powerful. Very well put. In a relaxed manner. I wish I had that kind of composure. You know, it's quite exciting, and you've given us a lot of depth of information, and we truly appreciate. Sorry, guys, today we started a bit late. We had a bit of a hiccup at the beginning, but that's internet for you. I thank you guys for being there, sticking in there, waiting patiently. And when we opened, we had over 100 people who got into the call. We went almost to 200 people, so that was amazing. So this recording will be available a little bit later today, so you can share it with your friends and everybody else. And next week we'll be back again, and we'll be talking about a different aspect of health. And so you can zoom in next week, and you can invite a friend along. It was great, great having you. So guys, thank you all. If you want to know more about the business side of things, because there's a business behind these products and a very lucrative business. If you want to know, you can make serious money that can transform your life and the life of your dependents. Join us tomorrow at 8 o'clock with Pascal Olo, who is going to take us through a business presentation on how you can be able to become rich through the Neolife products. Otherwise, adios. Thank you so much, everybody. Thank you so much, Daktari. Have a restful rest of Sunday evening. God, and see you again next week. Thank you all, and bye-bye.